I am Al Alexander, the Senior Corporate Communications Officer at the Ministry of Health, and I will moderate this morning's media conference. So without further ado, I invite Dr. Parshram to present the latest clinical update, followed by a status report on the monkeypox outbreak. CMO.
Hi, good morning. Thank you, Mr. Alexander, and good morning to the Honorable Minister. Good morning to Dr. Surju Singh, members of the media, members of the viewing and listening public. If I could have the first slide, please, which is the COVID-19 dashboard for the 21st of June 2022. It gives you update number 1,127. I will begin with the number of new positives. The Honorable Minister will go into the details related to the vaccination. So new positive cases over the last 24 hours, 145. Our 7-day rolling average for new positive cases stands at 158 at this point in time. Deaths reported today, 3, and condolences to the families of those individuals. Again, the rolling average 7-day for deaths stand at 3 as well. In terms of our total active positive cases, we have 7,077. Total patients in hospital at this point in time, 107 between hospitals and step-down facilities. And a further breakdown of those people in the different facilities. We have at the Couva Hospital and Multi-Training Facility 29 persons, 1 in ICU and 5 in the high dependency unit. At the Cora Hospital, 17 persons, Augustus Long 21, St. Anne's Hospital 1, Arima General Hospital 11, Point Fortin Area Hospital 6, St. James Medical Complex 7, Scarborough Regional Hospital Fort King George 13, and Scarborough General Hospital at Signal Hill. We have 2 persons at that facility. So if we could go into my brief update as it relates to monkeypox. So it's a global update as of the 22nd of June 2022. Second slide, please. So the data, which was formally released on the 15th of June, and this is between January 1st and 15th of June, 2,103 cases laboratory confirmed and 1 probable case. A probable case is not a PCR link case. It is usually done when you have a suspect case, and then an antibody test is done thereafter. So that in terms of the total number of cases, 1 probable and 2,103 confirmed cases reported to the WHO. Next slide. So these cases have been reported by 42 different countries across 5 regions, 5 WHO regions. That is the region of the Americas, Africa, Europe, Eastern Mediterranean, and Western Pacific. 98% of cases have been reported since May 2022. Next slide. The next slide will show you the proportion from different parts of the world, and the charts highlight the different WHO regions on the right hand side. So you see 84% were from the region Europe, 12% were from the Americas, 3% from Africa, which is where you normally find the endemic cases in West Africa and Central Africa. Less than 1% were from the Eastern Mediterranean region, and less than 1% from the Western Pacific region. So the majority of the cases coming from Europe and the Americas at this point in time. So next slide. So next slide will go into a little bit of detail as just to remind the public and our clinicians of the signs and symptoms. Swollen lymph nodes, fever, rash with blisters that can appear on the face, hands, feet, eye, mouth, genitalia, perineal or perianal region, headaches, muscle aches, and fatigue. A lot of times in the early onset of the disease, it looks very much like any other viral illness. If we could go to the next slide, it shows human-to-human transmission is occurring through close or direct physical contact with infectious lesions or ulcers, and types of contact will include skin-to-skin, face-to-face, mouth-to-mouth, and mouth-to-skin as the predominant modes of transmission. Next slide. Transmission can occur during sexual activity via respiratory droplet or contact with contaminated materials, objects such as linens, beddings, clothes, utensils, dishes, and electronics. At present, when we say electronics, we most commonly, of course, refer to your cellular phone. At present, it is unclear what role sexual body fluids play in the transmission of monkeypox, and research is still ongoing to see if it will be classified as a sexually transmitted disease. For every 100 monkeypox infections, anywhere between 1 to 11 deaths may occur. Of course, the lineage that is actually transmitting, the clade that is transmitting across the world right now, is the West African version of the monkeypox virus, which seems to be less virulent, and you get higher death rates with the Central African, the Congo Basin lineage. Next slide. So this slide highlights the vulnerable groups, and Dr. Sejru Singh, if you see the first one on the list, pregnant women, fetus, newborns, Dr. Sejru Singh will go into a little more detail with regards to that category in terms of children, immunocompromised persons, and of course healthcare workers due to their increased risk of exposure, not necessarily their vulnerable personal situation. Limited data suggests that infection may adversely affect the fetus, newborn, or mother, and this is coming out of data from the smallpox virus, which is akin to this particular virus. Of course, in terms of prevention, we continue to do what we've been doing for COVID-19, wear a mask, watch your distance, and wash your hands as frequently as possible. And of course, if you have signs and symptoms, stay away from gatherings. Thank you, Mr. Alexander.
Thank you very much, CMO. I now hand you over to Dr. Sejru Singh, who will speak about the risks of monkeypox in pregnancy. Dr. Sejru Singh?
Thank you, Mr. Alexander. Good morning, Honorable Minister and CMO. So first, I'd just like to say again, thank you to all of the healthcare workers with respect to what we have done with respect to the COVID response with our maternity teams and our neonatal units. We continue to have a full service in this area. We are doing very well with our maternal and newborn services in Trinidad and Tobago from the very start of the pandemic. Well, the CMO has given a brief update as well with respect to pregnancy, and I'll start by saying that the data we have with respect to monkeypox and pregnancy is extremely limited and liable to change as more data is published and presented. The initial information is what I'm going to be saying today, and we are taking, of course, a proactive approach. We are not going to wait for the first case to be diagnosed in pregnancy and everyone will be worried at that time. So I want to reassure the public that all systems are in place. All of the scientific information we've been receiving has been shared in our healthcare networks. They are aware of the signs and symptoms and the potential risk, and possible treatment algorithms are being developed as guided by international bodies, the World Health Organization, Center for Disease Control, as well as the colleges that give us scientific advice. But it's extremely limited at this stage. So, as we said before, in adults, monkeypox is usually mild and people recover in a few weeks without treatment. But pregnancy is considered a high-risk state with respect to any infection. You are considered immunocompromised, as well as there are some physical changes in pregnancy that will also increase your risk. The World Health Organization has stated that the monkeypox during pregnancy may lead to complications, including a syndrome called congenital monkeypox, which is still being defined, or stillbirths. There's very limited evidence to show that the disease can be passed from a woman to the baby via the placenta. That's called transplacental transmission, which can lead to congenital monkeypox. I said before, this data is extremely limited in terms of publications. There are just 4 cases reported in the literature at this time. In terms of mode of delivery, there is some advice. If you have active lesions in the genital tract at the time of delivery, for now we might be recommending a cesarean section, and this will be discussed with your healthcare teams. After you have given birth, there's evidence to show that, of course, close contact during and after birth, if you have active monkeypox infection, there can be transmission from mother and baby. In these cases, we will recommend separating both mom and baby in isolation. Again, the greatest risk seems to be, because as I said, the evidence is limited, but the greatest risk, of course, to pregnant women and newborn infants. Again, their immune systems are still developing, so they are at risk of becoming severely ill. So in terms of breastfeeding, the WHO this time recommends that the mom and baby be separated and there be no breastfeeding at this time until further information is obtained. The WHO is also reviewing future things such as the vaccine and vaccine safety, and further updates will be provided at a later date. I think that's it for now with respect to this initial information with respect to monkeypox. Thank you very much, Mr. Alexander.
Thank you very much, Dr. Surjit Singh. We go next to the Honorable Terence Dayal Singh, who will provide the latest vaccination figures and updates on the current initiatives regarding the national COVID-19 vaccination campaign. Minister.
Thank you. Very good morning to you all. Good morning to CMO Dr. Parasram and Dr. Surjit Singh. Good to have you back. Ladies and gentlemen of the media, very good morning to you and everyone listening wherever you are. So let's go through the vaccination numbers. First dose, 693,560 or 49.5%. Those who have completed their regime, 713,436 or 51%. So we have belatedly reached 51%. It took us a while, but we are there. Number of persons who have been boosted, 163,041. Of interest, since we started the vaccination program for our 5 to 11 cohort, we have done 1,467. And we encourage parents for this 5 to 11 cohort to get your children vaccinated as soon as humanly possible. On the topic of children, I have the schools data for the number of positive cases for the period 13th to the 19th of June. And we have had 43 positive cases from 31 schools. So that's a positive sign, but we still want our 5 to 11s to get vaccinated. That's it on the COVID front. I just want to reinforce and take a broader perspective on the monkeypox issue that both the CMO would have spoken about. He would have given you the international perspective. Dr. Surjit Singh would have given you the perspective as far as what we know or don't know about monkeypox and the pregnant population. Dr. Surjit Singh had used the word being proactive, and I want to agree with him. As the Minister of Health of Trinidad and Tobago, I am advising the population or asking the population to let's apply some of the lessons learned from COVID, and especially the introduction of COVID variants of concern like Delta and Gamma into Trinidad and Tobago. You may recall when cases were first identified by genomic sequencing, it didn't mean that the virus suddenly appeared in that person on that particular day. For someone to have been symptomatic and to have had a positive test for Delta or whatever variant, it means that the virus was circulating in the community in Trinidad and Tobago. It is that same lesson that I would like the population to take on board with monkeypox. Just because we don't have a confirmed or suspected case of monkeypox in Trinidad, don't wait until we confirm one to then be careful. We are asking persons to be vigilant from now. To be vigilant if you are in close personal contact, especially skin-to-skin contact, or sharing bedding and clothing with someone who may have recently traveled to one of the 42 countries that are now reporting monkeypox cases. In the case of Trinidad and Tobago, the majority of our travel will be from North America, the UK, and so on. But there's a list of the 42 countries available online. If you are in a family or in a close personal relationship with anyone who has recently traveled to a country where monkeypox is being detected, be cautious how you mix with that person in your household. And even when you go out to mass events, you don't know the person standing next to you, person sitting next to you. I distinctly remember in the early days of COVID, CMO, you were advising people to assume that the person next to you had COVID. I think with monkeypox, we need to take care and make that same sort of assumption, especially if you're in a large crowd and you don't know the persons or the persons in your immediate surroundings. So the general advice is that as a population, let's be vigilant. Let's take care. For those of us in relationships with persons who have recently traveled abroad, let's take care. Look out for the signs and symptoms. We have alerted all healthcare professionals in both the public sector and the private sector of what the signs and symptoms are, so they can make a clinical determination of whether this is monkeypox or not. So, as I close, I think the final message from me as Minister of Health is that all of us, myself included, need to be vigilant. We need to be aware that even though we don't have a confirmed or suspected case in Trinidad and Tobago, we do not wait until that day to then be careful. Let's all be careful from now and be extremely, extremely vigilant to ensure that we don't record too many cases of monkeypox. Thank you very much, Al.
Thank you very much, Minister. Up next is our question and answer segment. We do ask the media representatives to state their name and the name of their media house before posing your questions. We are asking for 2 questions maximum per media house in the first instance, and after that we will take any additional questions from the representatives as time permits. We'll take our first question from azpnews.com.
Good morning, Priya Bihari, ACP News. My first question is for Minister Dayal Singh. Minister, good morning. I wanted to get your take on what is happening at these fests where people are partying in the hundreds, sometimes in the thousands, but people in public still have to wear a mask. If you're at work, you have to wear a mask. If you're in school, you have to wear a mask. What is your take from a public health perspective on these partygoers who are not wearing masks at these fests? Thank you.
Thank you very much, Priya. You know, it's strange you should ask this question. We have been discussing this in some detail. Priya, you may recall many months ago when we started opening up the economy and doing away with public health measures. You may recall I was asking the population to do their own personal risk assessment. And the short answer to your question is that all of us have to engage in that personal risk assessment. How much risk do I want to take on to catch COVID or now monkeypox and take it home to my families, infecting children, infecting grandparents? So we are always concerned when we see large gatherings where people are not wearing their mask as they are entitled to in these gatherings, because we in these private settings you don't necessarily have to wear masks. But we continue to urge people to be careful because, as I said earlier, don't assume because you don't have a suspected case or a confirmed case of monkeypox, it is not here. The same assumption we asked you to make many months ago to assume the person next to you has COVID. Now do the same thing with monkeypox. I know it's uncomfortable. I know people are just tired of adhering to public health measures. I get it. But this is what the world has brought upon us. This is our lot to bear. And I think for the continued protection of our loved ones, we need to be careful and weigh your risk as you party or engage in any social activity that you may be endangering yourself and your loved ones. Thank you very much for the question.
Thank you very much, Minister. We go now to TV6. Ms. Boucher, good morning.
Hi, good morning to the entire panel. Alicia Boucher from TV6 here. Minister, I just want to jump in a bit on Prior's question. I remember during the course of the pandemic, the earlier stages, it was stated that once it's a ticketed event, that event then becomes a public event. So police had rights to enter these events where people were breaching COVID-19 regulations, not wearing their face masks and so on. But you just mentioned that these are private settings, so I'm a little bit confused. I don't know if you could shed some additional light on that, expound on that. And I just also want to ask, maybe the CMO could take this question. If, in terms of the week, the 13th to the 19th, there is seemingly a very marked decrease in terms of COVID-19 spread in schools. I don't know if you could tell us what might have been responsible for that massive decline. Thank you.
Yes. So thanks, Alicia. So you may recall, in those days, we had the safe zone concept. And we have done away with all of those things. So in these events, we are not insisting on masking. Things have evolved, things have changed as we come to the end of this phase of the acute COVID pandemic. However, with the advent of monkeypox, we have not instituted measures to deal with monkeypox, whether it's travel restrictions or anything else. So I think the previous advice that we gave is that assume that the person next to you is infected to protect yourself, because the safe zone concept, which we launched last year, October, I believe, is now out of the window. Okay, Alicia, over to the CMO.
Yeah, so I know basically what we're seeing in the country week on week is a 31.4% decrease in weekly total from last week to this week. Expectantly, you will see not only in the general public, but you will see that that decrease show up in the school system as well. Schools have now been open for about 2 months or so now. Generally speaking, what we have noted from other countries with Omicron is that it goes through any given population in about 6 weeks. The primary school population would have been a new population in terms of mixing and mingling. So they came out for the first time in April. So we are about 2 months into that, and technically speaking, you would have had time for that infection to go between those individuals, those households, and actually we're seeing a return to some sort of baseline prior to the reopening in April. So basically you're seeing Omicron going through the population and a decrease. We hope that the decrease is sustained going forward and we don't see a resurgence of any sort, unless, of course, there's a brand new variant that comes into the mix. But certainly we are seeing a population-wide decrease of about 30% week on week, and we hope that that trend continues in the coming weeks.
Certainly good news, CMO. Thank you. We go back to Prior Bihari for a follow-up question.
Minister, I just wanted to follow up again with this whole issue of mask wearing. So then what is the difference of not wearing a mask at a fete, but then you have to wear a mask in school, you have to wear a mask at the workplace? Why is that still in place?
Because we feel at this time that the wearing of masks in public and in schools is the correct thing to do to stop spread, whilst the wearing of masks in other situations is optional. We still give the advice, and I will give it again: exercise your personal responsibility. So if I go to a public event, I will wear a mask. If I feel I need to go to a fete, I will wear a mask. But the regulations still stipulate that you wear a mask in the public domain to protect our children in schools sitting down close to each other. We recommend that they wear a mask. But we urge all persons to weigh their own personal risks and take the appropriate measures so that you don't contract either COVID or possibly monkeypox. Okay?
Thank you for that clarification, Minister. Alicia Boucher, TV6, we are ready for your follow-up question.
Yes, thank you so much. Minister, when we got this first tranche of 75,000 Pfizer vaccines from the United States, you would have stated that depending on our usage of that, then there might be a second tranche of 75,000. Now that these vaccines are nearing expiry, the Pfizer vaccines that is, what has been the uptake of that particular 75,000 tranche? And based on our usage of that, would we be getting the second tranche from the US based on conversations that you may have had?
Yeah.
Thanks,
Alicia. So let me see if I could let's take another question. Let me delve into my records here and see if I get the question, if I could find the answer for you. So let's take another question.
Yes, Minister. And so therefore we go to Prior. We're ready for your follow-up question.
Thank you again. This follow-up question may be the CMO. CMO, the COVID-19 deaths we are having, is it that most of them have comorbidities now? And is it that you think they have the Omicron variant? Because I know that you said that the Delta is still around. But what do you think accounts for the death? Is it Omicron and comorbidities, or is it Delta? Thank you.
Yeah, so generally speaking, when we got the sequencing results over the last couple of weeks, you remember I would have said about 3 weeks ago we had 118 samples tested and 117 came back as Omicron, and one person had Delta in that particular group. Over the last couple of weeks we haven't seen any Delta in our sampling, so predominantly Omicron. Although Omicron is milder in terms of its virulence, it can affect and can cause death in persons just like the other previous variants, for example, Alpha and the other types of variants and Gamma that we had in the country. So it's not that COVID-19 with Omicron cannot result in death. It can. The majority of deaths that we have been seeing are in persons over the age of 60 with multiple comorbidities in the past couple of weeks. And that trend has been throughout the pandemic. What we have noted is that the deaths, even with Delta, and other variants, that the majority of the deaths have been in persons above 60 with comorbidities. So that trend continues. So it's not that COVID-19 Omicron strain cannot cause mortality. It can in those vulnerable individuals and vulnerable groups as well.
Thank you very much, CMO. Dr. Sujit Singh, with respect to the monkeypox, this current strain, has there been instances where it has been noticed that there have been transmission of pregnant women to their children, transmission of the virus?
Sure. Okay, so Al, the data in terms of publications, very, very limited. A lot of what we are saying relies on historical evidence of what would have occurred during smallpox a long time ago, when there were very limited scientific publications as well with respect to pregnancy. So we know, because it's a similar type of virus, we are assuming that there may be the same sort of risk as we go along with respect to transmission. During that smallpox time, there was indeed a very high maternal and fetal mortality and morbidity at that time. So again, we are taking this proactive approach, putting systems in place, put all clinical staff in the public and private sector on alert, signs and symptoms, establishing care protocols, and of course are waiting on international bodies to give us more scientific information. We are ready with all systems in place.
Thank you very much, Dr. Sujit Singh.
Yes, right. Yes, so Alicia, I have the information here for you, hot off the press. The total number of Pfizer vaccines is remaining on hand 40,762, which are expiring on June 30th. And I think that was from the 75,000 that we got. So we have not even used 50% of it. So the chances of us getting the second tranche of 75 are going to be close to zero, because the population at this point in time doesn't seem to have the appetite for vaccines. And I made that point very clearly, and our colleagues in the United States made that point to us very clearly, that if we don't show an appetite for this, we may not get. And let me just alert you what is the appetite for daily uptake. Yesterday, we would have administered a grand total across all our sites of 331 doses. That is first doses, second doses, boosters, everything. That is remarkably low, and that is why we crawled to 51%. I was able to announce 51% this morning, but there is no rejoicing in that, because it took us months to get to 51%. So that is where we are. I just want to make one other point on the monkeypox virus and testing. You may recall at the start of this monkeypox episode in May, we had indicated that we were working to have our own local testing capacity through CARFA. And CARFA will be the regional testing hub for all CARICOM samples. So CARFA has received their testing kits. They are in the process of validation that is ongoing. So they'll be able to test for the CARICOM region, which is good news. But even better news for us, I can now confirm that Trinidad and Tobago, at the Trinidad Public Health Lab, we will now have our own testing capacity for Trinidad samples. So our testing kits should be here very, very soon. Then you have to go through the process of validation and so on. So as far as monkeypox testing is concerned, to confirm a case, we are in a pretty good position within the next couple of weeks to have it both at CARFA for the CARICOM region and at Trinidad Public Health Labs for Trinidad and Tobago samples. So, Alicia, I'll give you the update on Pfizer, and I just gave the update on our capacity to test for monkeypox.
Thank you very much, Minister. We go now to TTT for your questions.
Sharon Brown Campbell from TTT News, but I'm asking this question on behalf of Nicole Dookie at IETV. She says her hand, she keeps raising her hand, but it isn't staying up. Her question is, there are children in the 12 to 17 age group who would have tested positive for COVID recently and are not able to get the booster before the June 30th expiration date. What should be done for them, given that you have to wait 3 months after being infected to get a vaccine? Will TNT be getting any more vaccines to facilitate these cases? That's her question. Thank you.
Yeah, so as Minister just answered, in terms of the Pfizer vaccine, because of our usage patterns, it is unlikely that after June 30th we'll be able to have a transfer vaccines for that particular age group, because that age group is authorized to use Pfizer at this point in time.
Thank you very much, Seymour. We go now to TV6 for a follow-up question.
Hi, yes. Thank you so much for all of the explanations. Maybe the CMO could take this one. CMO, there may be people who had COVID-19 and it adversely affected them, whether it's their organs and so on. There is a 3-month period wherein you wait to get a booster shot after getting COVID, right? So once you get COVID, you have to wait 3 months. What if that person, based on their experience, decides to take a booster shot before? Are there any health implications in doing so? Should they do so, given that, COVID-19 would have badly affected them and perhaps even weakened their bodies and so on?
Yeah, so the reason we have that 3-month waiting period is to ensure that persons exactly like the type of person you described, someone that had clinically severe COVID, is given enough time to recover from that particular illness before they have a vaccine. And of course, that was the initial recommended time in terms of safety overall. So we maintain the 3 months, as that time frame. And in Trinidad and Tobago, that is the government's policy in terms of the booster program. So once you wait that period of time, and of course, if you're having persistent symptoms, for example, long COVID, we advise that you seek the assistance of your medical practitioner before you have your vaccine to ensure that you're fit to have the vaccine as well.
Let me play journalist here and piggyback off Alicia's question. So over 18 now, if Pfizer is not available for them after June 30th, they can take Sinopharm.
Yeah, so anyone over 18, we continue to have Sinopharm as well as Johnson & Johnson in supply. So that is available in terms of boostering.
Thank you very much, CMO, and Minister, thanks for your question.
A plain journalist.
Yes. Private Harry, we are ready for your follow-up question.
Thanks again. I wanted to find out the COVID-19 at the schools. Is it mostly among the students rather than teachers and adults?
Yeah. So prior, I don't have the disaggregated numbers. I just have the numbers I gave you, 43, which I got from the Ministry of Education. It wasn't disaggregated, but in my conversations with Minister Nayan Gasby-Dolly in the past, she would have indicated that these figures are cumulative for both students and staff. But I don't have it disaggregated to say X amount for students and X amount of staff, but it is always amalgamated.
Thank you, Prior. We go to TV6 for another follow-up question.
Thank you again. I was asked this question this morning, so I would put it forward. Let us say someone waited something like 8 months to take their booster shot. We know that they can, as CMO, but are there any implications? Does it have the same effect if you waited that long to take a booster shot? Can you expound on that?
Okay. So generally speaking, we have a lower limit, right? So we have 3 months and beyond. So anytime beyond that period of time is where we advise that you have it. There have been some studies that suggest that the longer you wait, 6 months, 8 months, that you have a better response in terms of your immune response. But that, of course, will be with particular vaccines and particular variants. So generally speaking, once you cross that 3 month time period, you can go beyond. It doesn't matter how long you wait. You can have your booster thereafter.
Thank you very much, CMO. We have come to the end of our media conference for today. Ms. Dookie, I want to apologize. We really did not see you come up or see your hand come up during the segment, but hopefully that you will be able to join us and be able to field some of your questions next week. Thank you, ladies and gentlemen, for joining us today. And in closing, we ask that you please continue to protect yourself and your loved ones. As restrictions are being lifted, we also want to remind you, the public, to practice the 3 W's. And please continue to follow the Ministry of Health at these updated social media contacts for accurate and relevant health information. Please stay safe and goodbye for now.